Hello, for the informative speech, my topic will be on heart attack. So imagine one day when you walk down the stairs, you find your father is sitting in the sofa painfully, and his face is turning pale, and he's sweating all over his body, and he's struggling to breathe. For most people, they might immediately thinking, "Oh, this person is having heart attack." That's exactly what I experienced 10 years ago when I find out my dad was having a heart attack. So luckily, we were able to rush into the hospital. Eventually, he had two stents in his arteries. He was able to recover from the event. And so today, I like to shed some light on this life-threatening conditions. I will go over the causes and the symptoms and the treatments and some prevention strategies. So, what is heart attack? As mentioned, actually, according to Cleveland Clinic, heart attack, medically known as myocardial infarction, occurs when the blood flow to a part of the heart that is blocked, leading to damage or death of heart muscles. It is a medical emergency that requires immediate attention to prevent to prevent further severe complications or even lead to death. So the symptoms of a heart attack, most people would feel a chest pain or discomfort. Usually it feels like a squeezing in your chest. And a lot of people, when having heart attack, they try to press one hand against their chest to relieve the pain. And you might feel it feels like pressure, squeezing, and just enormous pain. So, and also the upper body discomfort, pain or discomfort in one or both arms, in the back. Some people feeling the pain in the back, their neck and their jaw and stomach. And also, when people having heart attack, they usually feel that shortness of breath. They couldn't breathe. They're trying to very hard to keep them keep breathing, but it's very hard for them to maintain oxygen level. Sometimes nausea, cold sweat, and vomiting would also accompany when people having heart attack. In my father's case, I remember when he was having heart attack, he has cold sweat all over his body, and he couldn't open his eyes, he couldn't speak, and he was just sitting there and very painful. So the causes of the heart attack, usually the most common cause where arteries supplying blood to the heart becoming narrowed or blocked due to cholesterol plaque buildup. So that means once you having over years of your life, and if you have a high cholesterol, that will build up in your arteries that will interact in blood flow, blocking blood flow. That is the most common case of for people having heart attack. So another cause is blood clots. So clots can form in narrowed arteries blocking blood flow. So and also temporary timing of the artery can reduce the blood flow and will also lead to heart attack. In For people with a high blood pressure, high cholesterol, if they have a smoking habit, or if they are obese, if they have diabetes, and if they continue living high stress lifestyle, that will also lead, also cause a person to have a heart attack. What are some prevention that would help people not having heart attack? Well, first and foremost is a balanced diet, because people these days people eat too much red meat. That was one major source to high cholesterol, and people should choose fruits, vegetables, and whole grain, lean proteins, and healthy fat in their regular meal, and also uh, regular exercise would help uh, people prevent having heart attack. It's recommended uh, uh, for people that to exercise at least 150 minutes per week, and it will help your body to help your blood flow, um, make yourself healthy. So for people who smoke, definitely need to consider quit smoking. Smoking damage blood vessels, because smoking damage blood vessels and increase the risk of blood clots, and and also lead to high cholesterol, which really can give people heart attacks. Uh, the other thing is limit alcohol consumption. Uh, I understand that people like to drink uh, when they having parties and holidays. They like to drink to celebrate. Well, definitely need to limit the volume, limit the amount of alcohol you consume, because excessive alcohol can raise blood pressure and contributing to weight gain, and also which can contribute to people having heart attack. So the last thing is definitely need to manage the stress levels. I understand that we're living in a high stress environment, if either your work or school, and people trying to catch deadlines. Definitely need to manage the schedule more, and definitely need to trying to breathe more, and having less stress could help prevent having heart attack. And regular checkup, definitely need to monitor blood pressure, cholesterol levels regularly. Go to doctor when if you're feeling anything that doesn't feel normal. So, what if you have by any chance, if you feeling that if you having heart attack, call emergency that is required. It's not something you can avoid. I understand people sometimes they don't want to go to hospital, but once you having the symptoms of heart attack, you need to go to hospital immediately. And and is when for some people seeing other people having heart attack, definitely perform CPR, try to give that person some breathing area, uh, maintain the blood flow until medical help arrives. So in conclusion, heart attack are serious and potentially fatal medical emergencies. Knowing the symptoms, understanding the causes, and adopting preventive measures can significantly reduce the risk of experiencing a heart attack. By making healthy lifestyle choices, managing risk factors, being prepared and respond promptly, we can take proactive steps to protect our heart health and live longer and healthier lives. Thank you very much.